I had double jaw surgery 3 months ago to hopefully cure my sleep apnea. Let me share with you how that experience was and how I'm doing now. I tested positive for sleep apnea about 2.5 years ago. The reason I had the test done at all was because I had to drop out of college because my health was just declining. I had always been exhausted, never really slept well, and constantly got sick. I ended up trying CPAP, bi-level, and tons of other treatments for a couple years, and nothing really worked well for me. I'm miserable, obviously. Especially in the fucking mornings. Especially when I'm going, trying new things, and nothing's working. Oh, it's torching my mental health, torching my physical health, torching my life, my work, my career, my interests, my relationships. It's traumatizing. I had a CT scan of my upper airway done, and it showed I had a very small airway, so then I committed to having double jaw surgery. Before having the surgery, I never had any palatal expansion. My inner molar width is 38 millimeters. I never had any pre-op orthodontia either. Yo, what's up? Day of surgery, March 3rd, 2025. It's like 7:20 a.m. I just hopped out of the shower and we're gonna leave here in a second with the Uber to the hospital. So boom, I ended up having the surgery. I got it covered by my health insurance. I went through the surgeon, Dr. Alfi, and my surgical plan was moving my top jaw 9 millimeters, my bottom jaw 10 millimeters. I was impacted by 1 millimeter with counterclockwise rotation, and I had nasal bone shaving done to improve my nasal breathing. The first week is the toughest, but in the beginning, a lot of swelling and a lot of numbness. For the first few weeks, my sleep was still not good. My energy levels were very low. You're not allowed to chew anything for at least 2 months, so I was having smoothies and blended soups only. Luckily, I have not returned to CPAP or bi-level or anything else since the day of surgery. I tried returning to my engineering job after 2 weeks of recovery. I wasn't performing well before surgery, and I didn't perform well after. I ended up getting fired. Eventually, I got back to chewing at the 2-month mark. I just have a little bit of numbness left in my chin area and my gums of my teeth. And so where am I at now? Shoot. Yeah. I think most of the swelling is down. Aesthetically, I think I got good results, although I don't think it's drastic. However, if you look at my CT scans, my airway has drastically improved, which was the goal of the surgery. I'm still drained and limited during my days, but I'm slowly improving. Compared to my sleep before surgery, especially without a machine, my sleep is much better. To be specific about how my nights generally are at the moment, I have maybe on average 5 awakenings per night. Most of those awakenings are within the last 2 hours of my sleep. And one important detail to note are that those awakenings no longer include a rapid heartbeat or feeling like I just got punched in the head. They're just a light awakenings, and then I go back to sleep. Also, I used to only dream in nightmares. Now I barely have any nightmares, and I have just regular dreams. So I think my airway is quite large. My nasal breathing doesn't worry me anymore, but I still don't have proper tongue posture. I haven't seen much results from myofunctional therapy yet, and I'm going to continue that in the future. Along with that, to help with my posture, I'm getting orthodontia to open up my palatal space a little bit. So that's what's up next for me. More myofunctional therapy, starting orthodontia, and then eventually I'm going to get my tongue tie released through my surgeon. What I think is crucial for my next steps is just allowing more time to pass, trying to live a healthy lifestyle, and possibly in the future, I might do some kind of breath training, as I sometimes think that my shallow breathing that I still have could be impacting my sleep. What my surgeon and even my orthodontist have been telling me is that I just need to give my neurology and soft tissue time to heal, and they expect me not to return to CPAP and to sleep really well eventually. So all in all, I was struggling immensely for years, especially the last couple years, all due to sleep apnea. After trying everything under the sun, I ended up going with double jaw surgery. The recovery for that surgery I didn't find too challenging. The first week or two are the hardest, and then the hardest part after that are probably having the right expectations that your sleep and energy levels, at least in my case, did not improve immediately. I thank you guys all for tuning in and supporting my channel. If there's anything I didn't answer, please let me know, or any way I can help. Stay tuned for more updates. I've got my best video idea coming up soon. Support my channel by liking, commenting, and subscribing. And to note, I do offer some services like phone calls or recovery assistance after jaw surgery. I talk about it more in my 2-month video, and I go over all these details that I mentioned in much more detail in older videos. This was just sort of a summary and a quick update. Thanks for watching, and I'll see you soon.
Yo, it's March 6th. I'm on day 4 of recovering, and just sitting here in the motel, drinking a protein smoothie and watching some Modern Family on the TV.